friends, this is Dr. Richa, currently pursuing post-graduation in internal medicine from New Delhi. As we all face similar kind of problems in learning or remembering during the NEET PG preparation, I am here for you to help you out with some interesting tricks and mnemonics to understand and memorize some important topics and questions. So let's get started. First of all, we start with the dermatology, Derma. We go very fast, okay, so that you don't have to put much of your time over that. Just go through your notes and just remember these mnemonics and tricks, and you will definitely be able to memorize. Okay, so let's get started. First of all, skin is having four layers, as you all know: epidermis, dermoepidermal junction, dermis, and then subcutis. First of all, epidermis. Epidermis basically consists of four main cells that are keratinocytes, melanocytes, Merkel cells, and Langerhans cells. Keratinocytes are maximum in number and the most important cells. Keratinocytes, the world famous mnemonic to remember the layer of keratinocytes is boys says girls look cute. Okay, it is from below upward, sorry. Boys means stratum basale, says means stratum spinosum, then girls means stratum granulosum, lucidum is stratum lucidum is look, and cute is for stratum corneum. The lucidum layer is found only in palms and soles. It's basically a thickened and modified form of keratinocytes. Okay, I want here to remember the mnemonic 512. Okay, 512. Okay, let me tell you one thing. If you remember 512, it will help you at two places. First one is here, and second one is in fields. I request you, all of you, to write it down. 512 is the mnemonic to remember the sorry, is to remember the age or expected weight of an infant and toddler from the birth weight. Okay, 5 is for like at fifth month the weight will get doubled by the birth weight. Then 1 is for at the first year the weight will get tripled, and uh, 2 is for 2 years, weight will get 4 times. Okay, here 5 and 2 is mnemonic for to remember keratin heterodimers. Okay, let me tell you, keratin heterodimers are basically of 7 types, but it doesn't contain the seventh type. So here we are, K1 to K8 are the 7 subtypes, mainly subtypes of the keratin heterodimers. Okay, 5 and 2 is a mnemonic to remember from below upwards. 5 is for stratum basale, 1 is for stratum spinosum, 2 is for stratum granulosum. So write it down just here, 5 in front of stratum basale and 1 in front of stratum spinosum and 2 in front of stratum granulosum. Okay, half of your job is done here. Now just write 10 in front of 1, 11 2, and carry on. Just remember 16 in front of 6 and 18 in front of 8. Okay, these are the numerical representation of the heterodimers. K1 is 1 by 10, K2 by 11, K3 by 12, K4 by 13, K5 by 14, K6 by 16, and K8 by 18. Okay. Now 5 and 2 is already done. Now come on to 3, 4, 6, and 8. Okay. Just look at this diagram, this pictorial diagram. Okay. Now see, third third is the third letter. 3 is the third letter. What is the third letter of the alphabet? Is crying, na? Okay, just remember C for crying. Okay, you will remember all the other heterodimers. C for crying, that is third. When you cry, your tears will flow, and sometimes you have the taste of your tears. Huh? You remember? Okay, it must have been happened to you any time in your life. Okay, uh, it's when your tears get into your mouth, then it becomes heteroderma 4, that is buccal mucosa. Here I have written it. Then, after crying, you wipe your tears with your fingers. So, when you use your fingers, there comes another heterodymer, that is 6. 6 is for nails. Okay, you just remember 3 is for crying. That means you cry from your eyes, and the outermost layer is cornea. So 3 is for cornea, 4 is for buccal mucosa, and 6 is for nails. You only have to cram one among them, that is liver, for 8, liver cirrhosis. Okay, the green brackets are showing the disease when these heterodimers got affected. When K3 got affected, we got corneal dystrophy. Similarly, for K5, we got epidermolysis bullosa, that is a splitting disorder of the skin, and K8, we got liver cirrhosis. Okay, all right. Now, coming on to the pigmentary disorders of the skin. First one, okay, I want you to remember these as per I have written and in the same sequence, okay, so that you can remember easily. First one, okay, first we have the cells. Now, the first one there is melanocytes. Then here comes the melanosomes in between the cells. Then ultimately the process of synthesis of melanin, that is melanogenesis. You remember this in this sequence only, okay? Melanocytes, then melanosomes, then melanogenesis. Okay. Now, melanocytes disorder, we have 3 disorders. Just remember it with mnemonic leaking PV, okay, leaking per vaginum. Write it below upwards. First one is lentigen, then pyrrhotism, then is vitiligo, okay. So, vitiligo is what? Vitiligo is an autoimmune disorder which causes depigmentation. It has many subtypes. We don't need to mug up all these. Okay. Then pyrrhotism. Pyrrhotism is what? Pyrrhotism is a patch of depigmentation mostly seen over the forehead with five white forelocks in between. Okay. Just remember this. Then we come on to the lentigen. Lentigens, there is increase in the melanocytes. It is a macule. Macule is, which is neither raised nor depressed. Then its disorder cause Peutz Jeghers syndromes. Okay, melanocytes done. Then we come on to the melanosomes. It is only one disorder, nevus anemicus or depigmentosis. Okay, just remember the name. Then the third one is the process of synthesis, that is melanogenesis. Here we have the mnemonic for to remembering the disorder of melanogenesis is FAME. FAME is, just write it down, FAME, and F is for freckles, A is for albinism, and ME is for melasma. Okay, okay. Albinism, I'll tell you later on. Just remember freckles and melasma, and in both of these disorders, there will be increased synthesis of melanin. That is, melanogenesis will be enhanced. So, how will you remember that whether it is generalized or localized? Just remember F for few means few or localized increase in synthesis of melanin, and in melasma there will be generalized increase in synthesis. Okay. Remember it like this. Now we come on to albinism and vitiligo difference. Many students got confused between vitiligo and albinism, so I have put it as a separate entity. Just remember, vitiligo is an autoimmune disorder, and albinism is an inborn error of metabolism, that is autosomal recessive, which is defect in the tyrosine synthesis. Okay, remember A for all in albinism. Okay, all means skin and hair, means all of your body is affected because there is no tyrosine, no pigmentation is there. Okay, and in vitiligo, only some areas are involved. Just remember this only.
Okay, guys, coming on to the next topic of Langerhans cells histiocytosis. First of all, what are Langerhans cells? These are the APCs, antigen presenting cells, which helps in phagocytosis and endocytosis. It's actually receptor mediated endocytosis. These are present in the dendritic cells, which are indeed present in the stratum spinosum. Okay, just to remember where these cells are present, just remember spinosome has spines, and spine is used to eat or kill any foreign body entering into the body or bacteria per se. Okay, so this is present in stratum spinosum. These are having Burbuck's granules. These granules are rod shaped or tennis racket shaped, characteristic features of Langerhans cells. Okay, now we're coming on to Langerhans cells histiocytosis, the main topic. Just remember the rule of three. Okay, rule of three is what? It is LCH, 1, 2, 3. Three letters are there. It has three subtypes. First one is little sieve, then eosinophilic granuloma, then hand, Schiller, and Christian disease. Okay, little sieve disease. You try to remember by little and sieve both words. Little means little child. That is, it is little sieve means little child, that is, it affects the children less than 2 years of age. Then sieve means it is severe, it is a fulminant disease, it can cause mortality. Then coming on to the eosinophilic granuloma, it occurs in less than 8 years of age. It involves bone, and most common bone is skull, and in skull the area is temporoparietal. Just remember granuloma involves the skin, the skull bone. Okay. Now coming on to the Hand-Schüller Christian disease. Remember Hand-Schüller and Christian, there are three words, and there is also triad, a rule of three. Rule of three will follow here only. It has triad. Triad, you just try to remember by the mnemonic, her ex ditched me. Okay. I deliberately put this mnemonic so that you won't get confused between the exophthalmos and endothalamus, and second one between diabetes mellitus and diabetes insipidus. Many students got confused in the exam between exo and endo and diabetes mellitus and insipidus. So I deliberately put this mnemonic, her ex ditched me. From her, HER, you remember Hand, Schiller, and Christian disease. Then X for exophthalmos, DISH is for DI is for diabetes insipidus, and M is for multiple bone fracture. Okay, so we are done with LCH. Now, coming on to some important histological findings found in the dermatology. First one is parakeratosis. Para, like parathyroid and other, like para means side by side or extra. Okay, you can remember like extra. So there is extra nucleus present in stratum corneum, which is normally absent. The examples are psoriasis, actinic keratosis, and eczema. These are the classical examples of parakeratosis. Coming on to the second finding, here we have collection of fluid. Collection of fluid can be either intercellular or extracellular. See, just remember, cell is like a balloon. So if you fill the balloon with water, that means you fill the cell with water, there will be intracellular fluid accumulation, that is known as ballooning. Okay, water inside the cell. Then extracellular, like a sponge. You remember like a sponge. Sponge absorbs water outside. When you squeeze it, it gives away all the water. So sponging is extracellular. The classical example for both of these conditions is eczema. Eczema literally means boiling out, inside and outside both. Okay. Coming on to the next topic, acanthosis and acantholysis. Just remember, these are the very important terms and the most important questions you can be asked in your NEET PG or any other competitive exam. So remember acanthosis, TH is, you just remember THOS. Okay, I have highlighted here. TH is for thickening, O is for off, just to complete the mnemonic, and S is for spinosum. Okay, you won't be get confused if you remember it like this. Okay, see, lysis, acantholysis, lysis means separation. So don't get confused between an acanthosis and lysis. Lysis is breakdown or separation, and acanthosis is thickening. Just remember thickening of the spinosum. Okay, remember it in this way only. Okay, thickening in the body, wherever you get thickening, that means it's a chronic process. It can be an acute process. So it indicates chronic disease. Example is in lichenification seen in eczema. Just to put a note here, irregular acanthosis in seen in lichen planus, very favorite questions of the examiner, you can be asked. Okay. Now, acantholysis, as I've told earlier, lysis means breakdown or separation. The keratinocytes are bridged by the desmosomes, so desmosomes are also known as bridging cells. When these desmosomes will be destroyed by any process like autoimmune process or any other process, so acanthocytes will be keratinocytes will be separated, and now these are known as acanthocytes. They have very large nucleus and a perinuclear halo is also present. Okay, okay, we are done for this. Now, coming on to the microabscesses. Microabscesses can be of three types, okay? Either these can be filled with neutrophils, then lymphocytes or eosinophils. Just to remember the neutrophil, let me put a very interesting mnemonic here. Just now, some days ago, you must have seen the ads on the Star Plus uh, for a reality show Mika Ka Swayamvar. Okay, just remember this Mika Ka Swayamvar on Star Plus. From Mika, you remember M is for Munro's abscess that is seen in stratum corneum. These all are neutrophilic abscesses which I am going to describe. Okay, first one is Munro's that is found in stratum corneum. Then Ka is for Kojog abscess that is found in Swayamvar is for spinosum. Okay, Kojog abscess is found in spinosum. Then plus is for psoriasis. That means these both abscesses are found in psoriasis. Guys, just try to remember this because this is a very important and very repeatedly asked questions. Okay. Now, coming on to the lymphocytic abscess. Lymphocytic abscess is found in mycosis fungoides. Mycosis fungoides is a T lymphocyte tumor. Okay. If in a T lymphocyte tumor, you are going to find only lymphocytic abscess. Okay. The classical example is mycosis fungoides, and this microabscess is known as Pottier's microabscess. Okay, all right. Now coming on to the eosinophilic abscess, just remember pemphigus vegetans is an example where we found eosinophilic abscess. You get twice E in the vegetants, you can remember it like this, or you can remember like many people have allergy from different vegetables. So in allergy we got mainly eosinophils. So vegetants has eosinophilic microabscess. Okay, just try to remember like this. Okay, now we are here to show you dermoepidermal junction. Okay, this is also known as basement membrane zone. Guys, this is very important topic because many questions ask from this topic only. This is a hot spot, hot topic. Okay, okay. See in the left side, leftmost corner, I have drawn the markings epidermis above, dermis below, and in between these two, there is dermoepidermal junction or basement membrane zone. Okay. Now you just try to recall the last layer of epidermis we have learned before is stratum corneum, and the heterodimer here is K514. We have learned earlier. Okay. Now just below that, we have plectin. Forget about the plectins, these are just bridging cells. Then next is the important cells that is BPAG1 and BPAG2. These are bullous pemphigoid antigen 1 and antigen 2. This is very important cell here because the bullous pemphigoid disorder pathology lies here only. Okay, so here you try to recall in pemphigus vulgaris, there is pathology lying intraepidermal. Okay, so there will be intraepidermal splitting and there will be subepidermal splitting in the bullous pemphigoid. This is the reason because the pathological cells lies in the subepidermal region. Okay. Next, coming on to the laminarin. Laminarin, you just remember like this lamina here. Next, we come on to the lamina densa. Lamina densa, as the name suggests, it is a dense. That means it is a tough layer. Okay. Last one is the sublamina densa, just above the dermis. Here we have to remember the collagen types, okay, which are generally asked as an MCQs. Okay, so first of all, you remember dense. D is the fourth letter of alphabet. So just remember Collagen 4 is there in the lamina densa. Then collagen 7, sublamina densa, you remember sub ka saath. So sub is sublamina densa and saath, that is saath means 7. Okay, so collagen 7 is there. And then last one is bullous pemphigoid. So in bullous pemphigoid, collagen 17 is there. So collagen 17, 4 and 7 is there. Okay, we are done with dermoepidermal junction. Now, next we come on to the important direct MCQs. These are some of the MCQs I have taken from the last years, which are repeatedly asked in the dermatology section. So I'll suggest you to at least remember these, or like go through a rapid revision of all these when you are going for exam. Okay. So let's get started. First of all, there is Nikolsky sign positive. Okay, what is Nikolsky sign? You just have to remember this, that Nikolsky sign is seen in the bullous disorder or intraepidermal splitting of the skin, where when we put a pressure over the bulla, there will be displacement of the fluid. Just remember this. This is Nikolsky sign. Nikolsky sign is positive mainly in intraepidermal fluid collections or blisters. So it is positive in pemphigus vulgaris and foliaceus. As we know, pemphigus vulgaris and foliaceus are the disorders of the desmoglein receptors which are present in the spinosum layer, which is intraepidermal. Okay, if you have to choose one among these, like vulgaris and foliaceus, then go for vulgaris. Other conditions where this Nikolsky sign is positive is SSSS, SGS, and 10. What is SSS? It is staphylococcal skin scalded syndrome and Steven Johnson syndrome and toxic epidermonecrolysis. Okay, I I'm sure that you must have been familiar with these terms. In these conditions also we get Nikolsky sign positive. Now we come on to the next important topic, that is difference between pemphigus and pemphigoid. Okay, pemphigus is intraepidermal bullae, as you all know, against the desmoglein receptor autoantibodies are formed. Then pemphigoid is also in bullous disorder, but it is a false bullous disorder because there will be subepidermal splitting, subepidermal bullae. As we have learned earlier, that bullous pemphigoid antigen BPAG is present below the below the epidermis, so there will be subepidermal bullae. Okay, so Nikolsky sign will be positive in the pemphigus and negative in the pemphigoid. Okay, coming on to the next, this is Wood's lamp examination. We examine the fluorescence. The wavelength here you can remember is the from the days in a year, that is 365 nanometer, around 365 nanometer. Okay, this is very important topic. Many of the questions has been repeatedly asked from this topic only. Just remember 4 to 5 of these. If you are interested, you can go through your notes and remember, or like cram all the other things or diseases, but these are most important ones. First of all, pityriasis versicolor, there will be apple green or yellow fluorescence. Then erythema, there will be coral red. Then tinea capitis, there will be green. One other disease in which you get green fluorescence is pseudomonas infection. Then tuberous sclerosis, in which there will be ash leaf macules, you will get bluish white fluorescence. Okay, just try to remember all these. Then coming on to the very important topic, that is dermatophytosis. It is the fungal infection. It basically consists of three subsets, that is trichophyton, epidermophyton, and microsporum. Just remember, examiners are very fond of asking these questions, like which among these is not involved in epidermophytons, not involved by microsporum. So try to remember these. I'll tell you a very simple trick. First of all, you remember dermatophytosis contains derma. Derma means skin. So skin is involved in all. Okay, half of your job is done. Now, first of all is trichophyton. Tri means all the three are present: skin, nails and hair. Then first remember microsporum. Microsporum doesn't contain N. That is, M doesn't contain N. Means nails are exception here. Nails will be spared here. So there will be involvement of skin and hair. Then the rest is epidermophyton that involves skin and nails. Okay. Coming on to the next topic, chirion and favus. Chirion and favus, both these are the disorders of scalp, and both of these are disorders of fungal infection. Okay, first of all, chirion. Chirion, you just remember the mnemonic: kids have school bags and mentors. Okay, kids, K is for kids and K is for chirions. School, S is for swelling and scalp. Bags is for boggy and mentors is for mentegrophytes. So chirion is a boggy swelling present over the scalp which is found in kids and is caused by Tinea mentegrophytes. That's all for chirion, and remember it's a very important hot topic for the examiner. Okay, coming on to favus. Favus, just remember this by first and last letter of the spelling. F is for foul smelling and S is for scutula. Scutula is formed over scalp and it is caused by the organism Tinea schonleni. Just remember this. Coming on to ectothrix and endothrix. Ectothrix and endothrix both are fungal infections. First of all, ectothrix is the fungal infection that involve the hair above the level of scalp, and endo involves at the level of scalp. Okay. Now, examiner asks what are the organisms causing ecto and endo respectively. First of all, ectothrix, I tell you the mnemonic to remember is very simple. It is caused by Microsporum canis. Canis is usually a pet, you know, canis is a pet. So the pet we used to put our pets outside the house. So canis is put outside. So it is an ectothrix. Then endothrix, you remember by the mnemonic TV, television, we put inside the house obviously. So it is an endothrix. TV, T is for Tonsurium and V is for Violatium. Tonsurium is the most common species found in India causing endothrix. Okay. Next topic is sporotrichosis. Sporotrichosis is also very important topic. Sporotrichosis is a disease caused by deep fungi, fungi that causes deep mycosis. Okay, it is caused by Sporothrix shankai. It is also known as rose garden or rose thorn disease. It usually consists of three stages. See, I have made a rose for you. The gardener will pluck the rose. The thorn injury will cause first stage, that is cutaneous stage or nodular stage. There will be a cutaneous ulcer or nodule. Okay, we give here only itraconazole. Itraconazole is the treatment. Then the nodule, the injured part, from the injured part, the fungi travels to the lymphatics and there causes ulcers and satellite lesions. Okay, here we also give itraconazole, but can also give saturated solution of potassium iodide. But if you have to choose one, then go for itraconazole. Last one is systemic. Systemic involvement can be there in the third stage. Most common involvement is in the lungs, and the drug of choice is amphotericin B. It's a very important and very hot topic for the examiner. Amphotericin B is drug of choice only for the systemic sporotrichosis, not for the cutaneous and lymphatic. So guys, just remember this. Okay. Now coming on to the chromoblastomycosis, as the name suggests, it is a chromo means color, that is pigmented fungi, and mycosis means fungi. So it is a disease of the whole information about chromoblastomycosis, that is variety of cauliflowers can be bought by penny or money. Variety means verrucous lesion or cauliflower-like lesion. Can and penny makes copper penny bodies and money makes medlar bodies. So copper penny bodies and medlar bodies can be seen under the microscope. So just remember this. Next we come on to the sexually transmitted infections. See, there are mainly four sexually transmitted infections that we used to study and examiners used to ask. But here we have to I have put here only chancroid because these all STIs can cause a lot of confusion among you to remember how to remember all the features. So I have just put chancroid here, all the features in a very easy way to remember the chancroid. Rest others you can go through your notes and read. I am definitely sure that it will be very easy for you. So starting with chancroid. Chancroid is caused by Haemophilus ducreyi. You can remember D is for dard or D is for dukhna. So it is painful. Painful is a key word here. I can tell you how. Painful key is a key. Painful ulcer and painful buboes both are there. Buboes are basically the lymphadenopathies caused due to the organism. It is the lymph nodes which get enlarged or swollen that are draining to the area where the infection is actually present. Okay, so remember ulcer. Just remember, if there will be single ulcer, there will be less pain or no pain, and multiple ulcers means that will cause more of pain. So multiple ulcers, that is why it is painful. Then it is so painful that it can bleed also, or you can remember vice versa, that it bleeds, so there will be more pain. So it is a okay. Let me tell you one thing. You just tell me, the soft thing will bleed faster or the hard fibrous thing will bleed faster. Obviously, the softer one will bleed faster, na? So there will be a soft granulomatous ulcer which bleeds easily and which are multiple in number. Soft things also got ragged easily. So it has ragged or undermined edges. Okay. Now just remember buboes. About the buboes, I have already told you that buboes are also painful. So buboes are tender. They are also ulcerative and unilateral. Now from multiple ulcers, you can also remember multiple fishes on slide. So on Jimsa staining, we'll get school of fish or railroad track. The organism can be seen flowing like school of fish. This is characteristic feature of Haemophilus ducreyi and very much probability of asking this question in the exam. Then for culture, there will be Muller-Hinton agar. Drug of choice for the treatment is azithromycin. Rest all other STIs, go through your notes. Okay, now we come on to the basic histology of the psoriasis. Okay, key here is to remember acanthosis. We have already discussed about the acanthosis, that is the thickening of the stratum spinosum. Just remember the acanthosis word, then you will remember all of the histology of the psoriasis. First of all, there will be thickening of the stratum spinosum. You remember the above the spinosum there will be granulosum. So if the spinosum will get thickened, the granulosum will be replaced by the spinosum. Okay. So replacement of the spinosum by granulosum. So there will be sorry, it is opposite. It is replacement of the granulosum by the spinosum. Okay, just correct it. Then so there will be absent granulosum. First feature will be thickening of the stratum spinosum. Second one, because of the thickening of the spinosum, there will be absent of the granulosum. Then above the granulosum, there will be what? Skip the lucidum, there will be corneum. So there will be persistence of the nucleus in the corneum, that is parakeratosis. We have already discussed about this. Okay. Now, when the spinosum get thickened, it will need more and more blood supply and nutrients. So there will be more dermal infiltration of the vessels. There will be dilated and tortuous dermal vessels. That is characteristic feature of the fourth characteristic feature of psoriasis. Then fifth one is dermal papillae infiltration by the T lymphocytes, because psoriasis is an autoimmune disorder. Okay. This is the pictorial diagram showing all the features. First one is thickening of granulosum, that is spinosum. Then second one, there will be absent granulosum. Third one is parakeratosis. Fourth one is dermal papillae, tortuous dermal vessels. And fifth one is infiltration of papillae by the T cells. Okay. Here we go. Next is the Cobner's phenomena. Cobner's phenomena is the phenomena characterized by when you put a scratch or there will be any trauma at the normal skin, there will be similar morphological lesions as present in the other part of the body due to some other disease. Okay, so this is known as Cobner's phenomena. Cobner's phenomena is seen in, you can remember by the mnemonic LPV. You remember we have already made this mnemonic, used this mnemonic earlier, leaking PV among where, you remember? Come on guys, tell me, you remember where we have learned this? We have put in the eosinophilic granuloma, or come on, no, we have not put in LCH. We have put it in the pigmentary disorder of the skin. Okay, these are the disorders of the melanocytes: lentigens, pybeldism, and vitiligo. Yeah. Okay. Now here we put it as a mnemonic to remember the Cobner's phenomena seen in lichen planus, psoriasis, and vitiligo. Okay. Here is a important note for you. False Cobner's phenomena is also seen like pseudo Cobner's phenomena in viral warts or molluscum contagiosum. It is due to the auto-inoculation of the virus. See, guys, if you scratch at your lesion where virus is present and you scratch at another site, there will be auto-inoculation of virus and similar lesion will be there. So this is not the true Cobners, it is the false Cobners. Okay, remember like this. Now the last one is scabies. Scabies, the important findings are burrows which are serpentinous or S-shaped, most commonly find in the interdigital spaces. It Scabies is a disease which causes severe itching, and there will be other family members involvement also. So there will be precautions for other members also and treatment also. Then here, extra edge is to remember the other disorders where severe itching is found in dermatology. The main two ones are bullous pemphigoid, which is the disease of elderly, subepidermal split will be there, and second one is dermatitis herpetiformis. Okay, scabies is caused by the bite of female mite, which is Sarcoptes scabiei var hominis. Just I want to emphasize here to remember the circle of Hebra. This is the distribution of scabies lesions usually found in the population. So here we go. First of all, there will be starting from the fingers, interdigital spaces, then wrist, then flexor surface of the elbow and forearm and arm, then coming on to the upper chest including nipples, umbilicus, and sometimes genitalia also. Okay, so guys, I hope this is all for the today. I hope there will be some or more than some benefit of this video to you. Just remember this and do it like a rapid revision just before your exam. And guys, don't worry, just put your 100%, give your 100% focus onto the preparation, on your preparation. You will definitely crack it. All the best, guys. Stay tuned for the next video. Thank you so much.